So tell us a little bit about what you're hiring for at Winona Health and also what makes Winona Health a special place to work.
So Winona Health, we have a lot of opportunities for local community members that want to provide excellent patient care to other folks within Winona. We have excellent opportunities for flexible work in our laboratory, for nursing, and then for folks that don't do healthcare in a patient-centered approach, we also have very human-focused opportunities in our business office and for administrative and support roles.
Winona Health has been sort of on the cutting edge of a lot of innovation in the last couple of years. Yeah. In a little bit, Emma and I are going to go to work in your new sim lab, but there's a lot of cool things with telehealth and Main Street Clinic.
There has been a lot going on around here as we sit here in our brand new sim lab, which we are warming up since last fall. We truly try to be innovative within all of our practices to make sure that we're meeting patients where they need. We have robotic surgery that just went live a couple of months ago, a lot of preventive care and hub work that's been going on for our community based on our community health needs assessment to make sure that everything that the community is identifying as a need, we are here to meet it.
Our mission, it's really our reason why we exist. It's to inspire, recognize, and empower the caregiver in all of us. We look at each of us here at Winona Health as a caregiver, whether you're in a clinical role working with patients or whether you're in a support role working in housekeeping, working behind the scenes in lab, or even in the business office. Everybody we treat as a caregiver. Our values in this is everything matters, everyone matters, every moment matters. So those are fundamental to us as well. From the standpoint of everything matters, we see somebody who's a patient, a visitor, has just arrived and they're trying to figure out where to go. We don't say, oh, turn left, take a right, go down the hall. We will actually walk them to where they need to go because those things matter.
I run the 5 high fidelity mannequins that we have. I program them to run any kind of scenario from birth all the way to the end of life, trauma scenarios we've run. Each room has cameras so we can record training. So if caregivers are so busy on the floor, they can't come down for the scenario, they can rewatch it. So they're still getting that learning experience.
We were so fortunate that our leadership determined that we really needed to have a space for people to learn. So when you come up into the sim lab, you'll see things sometimes taken out of order. You may not have gloves on. It's a space to learn, and we're really focusing on whatever skill or whatever scenario that we have. We're really focused on those high risk, low occurrence kinds of things. We can simulate that in here with all sorts of different care providers. Maybe they've never done a certain skill. Again, we can come in here and practice that. So when they see it out there in the real world, it's not the first time that they've done that skill. So
prepare them for whatever.
Absolutely, absolutely.
What is your role here at Winona Health?
I am a lab tech, so I draw specimens and I process them. I bring them back to lab, I log them in, and I put them on whatever analyzer that needs to go on. The specimen that we drew from the mom upstairs will run on a hematology analyzer for a hemoglobin test. I then introduce it to the line and it'll take it where it needs to go. Each module has robots in here that pick up the tube and take a picture of the accession number, which test it requests, which tube type it is, and what type of specimen it is. It'll take it directly to whatever analyzer. Each tube has its own puck, so it is assigned a certain route plan when it gets put on the analyzer.
70% of the doctor's diagnosis comes from a laboratory test. We run 24 hours a day, 7 days a week. We're always here.
How many openings do you currently have in the lab department?
4 currently.
Thank you for spending time at our facility for Wear It Wednesday. Please reach out to us if you'd like to join our amazing team of Winona Health caregivers.